So, hi everyone. Now we are joined by Dr. Miriam Smith, who is Joanna's mom and special guest of the podcast today. So, Miriam, can you please tell the audience about your company or where you started in your career?
Thank you so much. I do appreciate that. This is great to be here with you. Thanks for the invitation. I'm excited. My name is Miriam Smith, and I have been a nurse for more than 4 decades. Presently, I host the program on empowering new nurses. And my goal behind that is that I actually want to see my new nurses in particular be successful, helping them to provide high quality care to all patients.
And your program, is it a podcast?
My program is a podcast.
Okay, cool.
Yes. And I also have a YouTube.
Okay.
And my website includes empowering new nurses. And one might ask, why new nurses? The reason is that they have not really received that experience or gleaned that experience as yet. And they encounter fears, they encounter discouragement, and sometimes they might meet nurses who are not as helpful as they would have liked to in that initial phase. Therefore, I've seen from my experience whereby I have to onboard them in the profession, in the healthcare system, also orientate them. And I've seen the time varies in terms of from novice to be an expert and then to be proficient. So because of that, Joanna also has been instrumental in helping me to decide on the podcast because I definitely passionate about passing on the baton to the new nurses because I was retired recently. And so in doing that, I've been successful so far in terms of the responses and the rating that I've gotten from new nurses and even seasoned nurses. They said, Miriam, this was really refreshing, and the new nurses said, yes, this has really been helping me. So it's on Amazon. My book is on Amazon. I've seen where the ratings are high and I've had testimonials. So I'm excited about that.
And what's the name of your podcast?
My podcast is Empower New Nurses.
Okay. And where can folks listen to your podcast? What platforms?
They can listen to my podcast on Apple, on Spotify, yes. And I've had excerpts that I've put on Instagram and Facebook. At intervals, I do that. And of course, if you go to YouTube and you put Miriam Smith, that's me.
Wow. She's on all these different channels. That's amazing. Can you maybe show your book too?
Sure. So I know many young nurses out there and seasoned ones, and they have seen this book because I've had book signing and I've gotten great support. The book is entitled Nurse, The Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients. That's all inclusive, regardless of your color, regardless of your race, regardless of your sexual orientation, and regardless of your financial or your socioeconomic status. It's all inclusive. And something special about this book, I really thrilled about culturally congruent care. Because as I encourage my new nurses, we need to give individualized care to all patients. If you're from a different background, it's my responsibility, it's a nurse's responsibility to be able to give the care that will make that patient better or to optimize the care. Because if I don't know, and I encourage them, if they don't know the culture, they should research it. There are many resources out there. Apart from talking to their mentor, apart from going to YouTube, apart from researching different topics, it's important to know and asking the patients too. Because from that you'll know. In my culture, responding to pain might be a loud cry. To another person's culture, they will just take it very easy. However, when you talk to them and see their nonverbal action, you'll be able to identify. And as you talk, there's so much to learn. So I'm excited about that.
That's amazing.
Yes.
Joanna, I'd love to hear about what it was like to have Miriam as your mom and how she's inspired, your career path.
For sure. Well, I always tell my mom, thank you so much for birthing me. I was, I guess, a late baby, if you'd call it that. My mother was a very heavily career-driven young lady. And not only that, but how long were you on bed rest with me? Was it like 6 months or something? It was a long long time. So much so that the doctor actually asked her if she still wanted to have the child. So the fate of me being here laid in my mother's hand. And she said, yes, I still want that child. And I was the one that was all over the place. When it was time for me to come out, I was breached, which means my head was not down. It was up. And so they had to cut her. And so, when I think about all of those things that she had to go through, I'm just like, yeah, Mom, thanks. You didn't have to put yourself through all of that. But if she didn't, I wouldn't be here. So that's number one. That's what it's like to have an amazing mom. And then second of all, in terms of my mom's influence on my career, I know this is funny. My mom always worked super hard. She had amazing cases. She's being super humble right now. My mom has taken care of some very high profile patients, clients, some that were presidents of countries, flew on her own private jet with some of them, taking care of financial tycoons in the New York City area. And so, it was beautiful just to be able to see and be a byproduct, I would say, of some of those relationships that she had. So once again, I knew and I saw what was possible because, once again, your sphere of influence and the people who you were around. I also knew I did not want to be a nurse because I'm talking about the nice parts, but there were nights with some of the stuff that I heard her come back home with, in terms of how the patients treated her. I knew that a math problem would say 1 + 1 is 2 and a position function is going to yield me a time graph. And I'm okay with that. I'm going to tell the folks on the job I need it to be done before 3 o'clock and they're going to get it done. And I'm good. I'm not going to get the back talk. So I knew that with that type of work and the personnel that she had to deal with, I knew myself that personality that I have was not going to gel very well with her career choice. So even though I know it would have been beautiful to say, yeah, my mom's a doctor at the practice, I'm going to be a nurse. But the personality that's required, I don't have my mom's personality. We're both sweet people, but I think my mom is way sweeter. I think influence on that for me career-wise helped me to see very quickly that the health field was not going to be my area of expertise.
And earlier when I was talking with you, I gave some credit to your dad for his approach, sink or swim kind of approach with you. But now that we have your mom sitting here, I really wanted to make sure that we highlighted the impact that she had. And also hearing you talk about your mom, and she was a working woman while raising you and your sister. Yeah. And you're mentioning that she was performing at a very high level. She was taking care of high profile cases. She has a doctorate. And I think we talk a lot about representation, like seeing a woman with ambition and performing at a high level while taking care of her kids, while being present as a mother. I think that is incredibly powerful.
Definitely.
Yeah.
Thank you,
Miriam.
Thank you. If I might just share with you that 9/11, I definitely was one of the first responders there. And that it's also in my book, this experience I had to share. Seeing the fatalities and being there in person, it was unbelievable. Going home, reaching home and seeing them, my 2 girls at home, and I was all white, when I reached home. So it was unbelievable, the experience, what it was like. But to have gone through that and helping humanity, I knew that many people have died, and even someone that I knew, the family, died there. It was emotional, but at the same time, I'm happy I was able to do for the less fortunate, the most vulnerable at that time. And I attribute that to my background because I actually volunteered to go down there and help. So every time we have 9/11, that comes back. I reflect on that, being there, helping humanity. To me, is profound.
Thank you for doing that. And that's such an amazing, I'm so glad that you were able to talk about that in your book. And that actually, I can see the thread continue with Joanna of wanting to serve and give back. I know that you, in watching your mom work, you're like, I don't want to be a nurse. That is totally fine. But I think you saw your mom serving others and being in that role of so willing to help people and publishing a book. And now you started this nonprofit and you also publishing a book. So I feel like that's so beautiful. And thank you so much for being on this podcast as well, Dr. Miriam. I really appreciate you raising Joanna too, so that she can give back also. So
and thank you so much for inviting us. We really appreciate it, because the world we have over 8 billion people out there, and our stories, your story is unique. her story is unique, my story is unique, and others will be influenced by it. Thank you so much. You're doing a great job.
Thank you. And thank you everyone for tuning in to this episode. So special. Thank you guys.